Hi, I'm Mark Rutterman. Coming up, North Carolina response to coronavirus. We'll talk with Speaker of the House, Tim Moore, next. The North Carolina House has formed a task force to deal with the coronavirus. We're joined tonight by Speaker of the House, Tim Moore. Mr. Speaker, appreciate you being with us.
Good to be with you, Mark.
Why don't we start with the governor's stay-at-home order?
You know, we're certainly in unprecedented times, and the public health officials have looked at this and deemed that it is important, not only in North Carolina, but really around the country. If you look at what President Trump has done, that folks really restrict their activity, that they don't go out and be out in places unnecessarily, because we know that this virus spreads so easily. It's so contagious. Once you can hear about how long this thing lives, for example, on services. So I do think that the current stay-at-home order that we're under is relatively lax in some ways to allow folks to take care of what they need to. Essential businesses can operate. It's important that manufacturers and construction continue there. We know, though, for example, that restaurants, hotels, folks involved in personal care services, these folks have really taken it very hard. And so while we understand the need to restrict that activity so that the public is protected, we also know that these businesses face some very unique challenges. And so as we get into this process, one of the things that we're looking at is what our businesses are dealing with in respect to these stay-at-home orders. We know it's an unfortunate necessity right now because we don't need this virus to expand. We don't need our emergency rooms and other medical facilities overrun. We need to make sure that the demand does not exceed what we have capacity for. And so the reason you're seeing these kinds of orders, not only in North Carolina, but throughout the United States, and even as mentioned, the President's talked about this, it's just an unfortunate necessity we're in. But I'll tell you, Mark, I hope that it's has the least restrictions as possible, so folks can take care of the things they need to, take care of their homes, and so that those essential businesses continue to operate, and so that we minimize the impact as much as possible to our state's economy.
Mr. Speaker, are you talking to the governor on a regular basis, on a daily basis, and is this order going to be reviewed on a weekly basis, a daily basis, so we can get North Carolinians back to work?
I do talk to the governor every few days, and he has kept us informed of what he is looking at, and I too have shared with the governor what we're doing at the House of Representatives. As you know, we have appointed these task force, which are bipartisan in every way. We have Democrat and Republican chairs of the committees. We've tried to draw from the expertise of members from around the state to be able to offer that input and that advice that we think will be helpful not only to our branch of government, but also to the governor and the other folks in the executive branch as they make those decisions. So we have had conversations, and will, for example, a legislator from another part of the state may have something that's unique there that business owners are seeing, and we'll make sure that's being communicated to the governor's offices, so when they are looking at these statewide policies, that it does take into account the various nuances we have. I mean, this is a big state, and we are fortunate in that there are areas of the state that have no cases. Unfortunately, however, we've seen, particularly in our urban centers, numbers of these cases. And so we know that the challenges that may be affecting Mecklenburg County, Wake County, Durham County, et cetera, may be very different than what's happening in Terrell County or up in Graham County in the mountains. So while we understand the need for a statewide limitation on traveling and folks being out, we also appreciate the fact that that's been taken into account and that nuances have been provided for that allow for areas to also adapt as well.
Are you pleased with the government response so far? And are we getting the resources we need, our first responders? Do we have the masks, the ventilators, the gowns that they need?
So as we speak, ventilators are being produced all over the country, not only new ones, but older ventilators are being rehabbed and brought back to life to be used. The manufacture of personal protective equipment, both in terms of the mask, in terms of the gowns that are needed, and all that other protective equipment, there's still not enough out there, but it is coming in, and it's just a matter, Mark, of getting this stuff produced and getting it where it needs to be. What I can tell you is that I have never seen the amount of cooperation and collaboration between state government, local government, private providers, hospitals, and the federal government to try to get these resources where they need to be. But it simply is taking some time to get there. But right now, it does appear that the resources are getting there, but it is not as quickly as we necessarily would always want to see. And one thing I want to say, I mentioned the federal response. One thing I can say is that Senator Tillis has worked very hard at the federal level to make sure that those resources are being brought in from there as well. And I'm talking, just as I'm talking to the governor pretty regularly, I'm also talking with Senator Tillis.
Do our hospitals have the capacity to deal with this virus, and particularly our rural hospitals?
So the capacity is very simply going to be determined upon how many folks show up at the hospitals at a particular time. Your viewers, no doubt, are aware of this talk about flattening the curve, right? That you don't want to see the sudden spike like this in infections and that many of people having to go to the ER all at once. So it's important that as this spreads, that for that vulnerable population that will require hospitalization and treatment, that it not be a situation where everybody has to be there at once, that we essentially buy time, that there is the opportunity for more of that protective equipment to get there, more ventilators, more of everything to provide for these folks. For example, more rooms. You mentioned rural hospitals. A lot of rural hospitals don't have many, or in some cases any, intensive care units. And so we need to make sure that they have the facilities in place to take care of those folks in the event that the ICUs at the larger hospitals are occupied. So we need to make sure that we're able to disperse that. Another thing is, while we're dealing with, of course, the coronavirus, I mean, people are getting sick for other things. People are having heart attacks. People are involved in motor vehicle accidents. All of the other medical issues which come up still happen. So while we are dealing with those suffering from COVID-19, we also know that our hospitals have to be in a position to take care of the folks who are sick from other reasons. So it's a matter of not overwhelming the system.
Are you satisfied with the pace of testing? Will we see drive-through testing sooner rather than later?
I would like to see the testing occurring at a more robust rate. I do think that there are folks who are not getting tested who probably should be getting tested. Look, as I talk to folks around the state, I do believe that this virus, and this is all anecdotal, but I do believe this virus has probably been here longer than folks have been talking about it, which I guess is both good and bad. It's bad in the sense, obviously, if it's more widespread. The one positive, if you will, is the fact that it appears there are a lot of people who have gotten this virus but have been asymptomatic, that they have not required medical treatment. So it means in those cases, at least, that it's not as harmful for a lot of the population. But we know for certain members of the population it is absolutely devastating. And it's just a matter of numbers. It's a matter of how many folks show up at the same time needing that advanced treatment, and does it in fact overwhelm the system? So from the anecdotal evidence that's out there, I think this is a virus that's probably been with us now maybe a little longer than folks have thought. But it's something that our healthcare workers, our healthcare institutions are trying to grapple with. And I'll tell you, Mark, it's everybody wants more testing. I want more testing. Everyone wants more availability. But this is just something that within just that wasn't even talked about really until the last matter of weeks. And so what I see is a healthcare system that is doing all it can to make sure that every one of us are taken care of. And every day that we delay any kind of need for increased numbers of hospitalizations is good. That means more people are going to be okay. And every day these hospitals are ramping up, both in terms of the PPE, the testing, all of these things that they need.
The president talked today about hazardous pay for our first responders. Would you support that?
I certainly would. Our first responders are on the front line. People talk about that as they're running out of a burning building, the firemen and other first responders are running into it. Well, we have, of course, right now the greatest health issue that any of us have seen in our lifetime. It's a scary thing. I mean, people are scared because you can't see it. You can see a hurricane, you can see these things, but you can't see a virus. And the fact that it's asymptomatic for so long is what makes it especially dangerous in a lot of ways. But what we're doing is we're requiring our first responders, whether they are in fact dealing with a patient who is suffering from this or suffering from dealing with something else that where the person may have this condition, they're having to go in and take care of folks. And so they're also the most likely individuals to be afflicted. I've seen numbers where, officers in police departments, EMTs, hospital workers have had this. And so what happens? Obviously, those individuals suffer from this just like the rest of us. But then also you have folks who are critical to us getting past this who have to be quarantined for several days. And, of course, that only adds to the burden on the other healthcare workers and to the system. So I certainly think anything and everything that we can do to improve the lives of these frontline first responders, we ought to do it.
Is FEMA involved in this state at this point right now to help with housing, help with other issues, sir?
My understanding is that FEMA is working with the state, that there are active discussions and collaboration with our state emergency management in terms of knowing what all they are providing. I think at this point, as we're taping right now, Mark, it's almost like when we talk about what things will be done, we're almost talking about the cleanup after a hurricane, but we're still getting battered by the hurricane. So I think we won't know fully what support is needed in the end from the federal government and, frankly, from every layer of government until we get more toward the end. But right now, in terms of providing those resources, the protective equipment, that's critical. And then, of course, I know we're going to talk later here in the segment about the federal response, but clearly the federal government has stepped up in a major way, and I'm very glad that they have.
Well, let's talk about that. How can we fast track these SBA loans to small businesses, restaurants, and such?
Well, a couple of great things have happened at the state level, first of all. You may know that the Golden Leaf Foundation announced grants available to businesses up to $50,000. They've already had enough applications where those funds have been depleted. Something that I'm supporting is looking at seeing what we can do at the state level to assist where there are, let's say, where there's some shortfall or some shortcomings with what the SBA does. But in terms of the SBA, the Small Business Administration, that process needs to be as streamlined as possible. We need to make sure that those businesses needing these resources get them. And think about this, Mark. The effect of businesses varies up and down the line. Restaurants, for example, were told that they had to close, that they had to transition to carry out only. So it wasn't like they were had a secondary effect. They had to do so because of an order issued by the government. Now that was done, of course, to protect the public and to help reduce the spread. That's smart. But those businesses really have been on the front line and are the ones that are really taking it the hardest right now. But restaurants, the hotels, anything in the restaurant lodging industry, they've really taken it more. Now, of course, you have your personal services, everything from hair salons to massage therapists, anything where folks are coming in contact with one another. They now no longer can't operate. And the one thing is most of these businesses are small businesses. They're not large chains or corporations. These are North Carolinians here in our state who own these businesses, who employ workers. And so they have really taken it very hard. So I think it's very important that when it comes to these Small Business Administration loans, that they be done just as quickly as they can to get help to these folks, because what they need right now is those businesses need liquidity. And I'll tell you one other thing, Mark. When I talk to those business owners, you would think they would be talking a lot about their business model and so forth. Without exception, from one end of the state to the other, every single one of them are concerned first and foremost about their employees.
Let me say this. The federal government has set up banks or Federal Reserve to provide liquidity, correct?
It has. There's, of course, plenty of money being infused there. We know the direct payments that are being made, for example, to individuals, the $1,200 coming to individuals, the money being allocated for, based on number of children one has, to get assistance there as well. So there have been a lot of things. There's been money put in. Of course, the SBA process is being funded at probably what will be seen as a record amount. So absolutely a lot of things are being done for liquidity. Additionally, delaying the time period for which taxes need to be paid, which also is something that I'm very strongly supporting and feel confident that we will do when we come back into
Waiving
session.
unemployment taxes as well, right?
Absolutely. Not only delaying them, but actually waiving them. My position is that for this first quarter, the unemployment insurance taxes that businesses pay, that we just waive those. We don't collect them. We don't need to. Let the businesses keep those. And I'm going to tell you the other thing that North Carolinians should be especially proud of. We have budgeted in a very wise manner, particularly since coming into the majority and really having control over what's done. Where we are right now, before we went into this crisis, we had a $3.9 billion fund in the Unemployment Insurance Trust Fund. So that's good because that makes sure that we're going to be able to take care of our workers. We know that when folks draw unemployment, they're going to be able to count on getting a check. And I certainly support getting rid of those delays. No reason them having to wait weeks. No reason to have to jump through all these hoops and all this red tape. We need to get that assistance out to these workers as soon as possible and make sure they get everything they're entitled to.
How will this crisis affect our revenues, our receipts, our budget?
Well, we know revenue is going to be down, no question about that. We have about $1.2 billion set aside in what's called our savings reserve or our rainy day fund. We have roughly another $2 billion in unappropriated balance. But that's what we have that's not spent, that's not already going. Well, we know a couple things are going to happen, Mark. Number one, we know there's going to be an increase in the need for services. We know that's going to need to be there, and we're prepared to pay it. We also know that as long as we're dealing with this, revenue is going to be down because folks aren't earning as much. Some aren't earning anything. And we know that sales tax revenue is going to be much lower because we're not collecting the sales tax from commerce. So while individuals, businesses, families are having to accommodate and learn how they're going to have to get by on less money in a lot of cases, so too are we in government.
So you're going to have some tough decisions coming up in this next session of the General Assembly. Are you seeing more bipartisanship, more folks reaching across the aisle? Are you working with the governor already on this?
So definitely bipartisanship. It's great to see so much of that. I had told someone before all this happened that I had never seen, in terms of the political discourse out there, it seemed like our nation and our state was just more divided than ever. When folks would talk about each other, it was almost not like it was the opposition. It was almost you would hear people refer to each other as enemies, and that always took me aback because I've never considered anybody I disagree with an enemy. We just have a difference of opinion, and what this has done is it's reminded everybody that first and foremost that we're Americans, that we're North Carolinians, and that while there may be issues, important issues, frankly, that we disagree upon, that the most important thing is that we know we all care about this nation and this state. And although we sometimes have different ways to get there, we know that we need to do all we can to help the citizens across this state and across this country. And so it's been great to see folks from all parts of the state and all political parties working together in a way that I haven't seen in a while. So I'm committed to see that we continue to do that because I tell you, it's during hardship like this that you're reminded what's really important.
Mr. Speaker, how will the General Assembly operate? How will you vote? How will you caucus? How will that proceed?
So for those who have covered the General Assembly, on the floor of the House, there's 120 members, and each of us have desks right beside one another. In the Senate, since there's only 50, they're a little more spread out, but they're certainly not socially distant as recommended. What we have done now is that I appointed a task force to deal with the issues facing this state due to the coronavirus. And what I've done is for the first time in the history of our General Assembly, we have our committees meeting entirely remotely. Most members are at their home and they're dialing in through an app that we have where they're able to log in and hear the debate. Everyone's able to see one another. By the way, to a lot of my colleagues out there, I'm going to remind them there's screens there so I can tell a lot of the guys haven't shaved in a while, all right? But we're able to see one another and we're able to have a discourse. And so, what that means when we come into session, I don't see when we come in at the end of April, if this thing is still going the way the way it is right now, we don't need everyone in there right next to each other. So we're going to work through doing as many things as we can via remote, and where there are situations where we all need to be there, for example, for final votes. instead of having a short time period where everyone would have to be in the chamber at the same time to vote, extend it out maybe a half hour, maybe even an hour, whatever it takes.
So
that
3 or 4
can come
folks
in
at a
around.
time, correct?
Exactly.
Okay. Let me ask you, what would be your key agenda items, sir, as the General Assembly gets started up, and will you be coordinating with the governor on this?
We will certainly be working with the governor. I'll also be working with Senator Berger and Lieutenant Governor Forrest because I think it's important. This is consensus all the way around. First and foremost, of course, we want to get a budget done, and we want to get a budget that gets relief out there to these small businesses that are being disproportionately impacted by this. Second, we want to make sure that we have provided for all of the health care resources that are needed in terms of making sure people get access to care and in terms of making sure that the hospitals and other facilities have the resources they need to care for North Carolinians. And then we also need to take care of our students. I mean, education is the biggest part of what we do in state government. And right now, all across this state, our students are home. So we know that transitioning the teaching method, both short-term and, frankly, I think even long-term, to a lot more distance learning is going to be necessary. But we need to make sure that students who are midway through or were early on in the second semester of the year are able to complete their studies, that they get the educational material and learning that they need. And then, of course, a lot of kids, like my youngest son, he's a senior. So he graduates this year, so that these seniors can graduate and go on to college. And I'll tell you, Mark, I'm wondering, and maybe even more as a parent, I'm kind of wondering what that looks like. I mean, a lot of folks watching right now are parents. They're wanting to know, when's it safe for my son or daughter to go back to school? What does that look like? And those are things that we're looking at as well, because I can tell you, we're going to make sure that every North Carolinian gets access to a great education.
Mr. Speaker, let me ask you this. How will student loans be handled when we're talking about students now? How will that be handled?
Well, I certainly think that given the circumstances, there may need to be some extensions on student loans, of course, where folks have paid in, where students have paid in, for example, to live in a dorm or whatever it is, they need to be refunded that money, or pro rata refund and apply to next year's tuition. So all of that needs to happen. We don't need the students, many of whom are struggling already, to get an education and to pay for it. We don't need to see them disproportionately impacted by this.
Let me ask you, Mr. Speaker, long-term impact on North Carolina's economy. How fast can we bounce back?
North Carolina's economy up until this happened was absolutely rocking along. We'd had the lowest unemployment we'd had in decades. Of course, taxes are the lowest they've been in anyone's lifetime. Things are really doing well. We're very fortunate that North Carolina was in that position, because when this has hit us, we are actually in decent financial shape. Not all of the states dealing with this are. There were, I think, New York and Illinois and a few states that were already in the red fiscally. My suspicion is that the great business environment that North Carolina had, that was allowing us to be so successful, will allow us to recover from this more quickly than a lot of other states. And so I think we will get through this. And I think the president is right when he says that he thinks there's a lot of pent-up demand, that once this is passed, as folks are going to want to engage in commerce. I think you will see that. How
can our viewers get a hold of your office, sir?
So my telephone number is 919-733-4838. That's at the Legislative Building. I'm there most days. Our staff we're kind of rotating staff around, but anytime we can ever help, we are absolutely glad to do. The email address, if you can post it on the screen, is tim.moore@ncleg.gov.
Okay, and what's your website, please, sir?
It's the legislative website, ncleg.gov.
Okay, any final thoughts in about a minute and a half here, sir?
Well, I think it's important for North Carolinians to know that everyone at every level of government, federal, state, and local, are working together, that the needs of our citizens are not being forgotten.
Let me ask you this. As we go forward, will we have the money at the end of the day to take care of the unemployed? Are we going to have to go back to the well with the feds and ask Senator Tillis and others to get more money to flow into North Carolina?
you know, we don't know exactly what's going to be needed at the end to take care of our workers and our unemployed. But I'm certainly committed to see that we do all that we can. These are folks who, through no fault of their own, now find themselves unemployed. These hard-working North Carolinians, and we as a state and as a nation need to do all we can to take care of those folks.
Is it possible that we could get open back for business county by county?
You know, I think that is very possible. If you see that we're on the downside of that curve and you have low occurrence and low risk factors in certain regions, I certainly think it's appropriate that we get as much of it back running as we can. Look, at the end of the day, I and everyone else want to see North Carolinians safely get through this, get the medical care they need, and that we make sure that we do all we can, that our economy is able to recover and be even stronger than before.
What data points are you going to be looking for to open North Carolina back up for business?
We would clearly be looking at the rate of the cases. We would be looking at hospitalizations. We would be looking at outcomes of that, and we would be looking at new infections. Is it less? Are the numbers increasing or decreasing? And those are being released on a daily basis. And I think when we see those numbers and we realize we're on the back end, that point that we start trying to move things forward. But I'll tell you something, Mark. I firmly believe that these are trying times right now. But these are days that I think we'll look back one day and realize these are some of the finest days for North Carolina, because we'll show the can-do attitude that we have as a state and the time that North Carolinians come together to help
We've
one
got
another.
to roll, Mr. Speaker. That's it for us. Thanks for joining. Please follow the CDC rules. Stay healthy, and thanks for watching.
Quality public television is made possible through the financial contributions of viewers like you, who invite you to join them in supporting UNC TV.